My name is Andy D'Antonio, and I am the Director of Communications at the National Health Law Program. Today, I am interviewing Chanda Freeman, Health Policy and Advocacy Manager at Tennessee Justice Center as part of NHELP's Working Better Together blog series. This series gives our health law partners a platform to highlight successes, challenges, and innovative approaches to furthering health access and health equity in the states where they work. Welcome. We are so glad to have you here today.
Thank you for having me. I'm excited about having the opportunity to share our work.
Tell me a little bit about the background of Medicaid in Tennessee.
So historically, people who have lived experiences with Medicaid and our health disparities have provided insight into the lives and resiliency and hope that keeps people alive and keeps people in community with one another. So we know that every year that thousands of people are dying preventable deaths because they can't afford adequate health care. So right now in Tennessee, over 300,000 Tennesseans are living without health care, or they're in the coverage gap, meaning that they have no access, that they lack insurance help to cover medical costs. That's over 300,000 Tennesseans who must regularly choose between providing essential supports for their family, like keeping food on the table or paying their electric bill and visiting a doctor. And we know that the vast majority of Tennesseans agree that the government should expand health insurance options so that everyone can have quality, affordable coverage. So we know about 87% of folks living in Tennessee want the government to expand quality coverage to more of their neighbors, and that number is even higher in rural areas.
So why is it so important for you and for Tennessee Justice Center to amplify the voices of people with lived Medicaid experience and those who have experienced health disparities?
We believe that storytelling reminds us of the humanity of people, that there are stark racial disparities in health outcomes for residents of states that have not expanded Medicaid. We think that amplifying the voices of these folks, they do a couple of things. One, they influence the public narrative. When we are able to insert those voices of the socially or economically vulnerable populations, of people who are actually living through these experiences, that it reminds people that this is not just about numbers, that these are actual lives that are at stake, that we're not talking about policies, we're talking about quality of life and health outcomes. We also think it's important to amplify the voices of people who are having these experiences to raise concern about systemic issues. We know in Tennessee that Blacks are 2 times more likely to be uninsured, resulting in higher rates of heart disease and cancer and diabetes. We also know that 60% of folks who are living in the coverage gap in Tennessee are Black, Latino, or Indigenous or Asian.
Important to collect these stories, to hear people's lived experiences, but I'm sure it's difficult to get them. What are some of the reasons that people don't share their stories?
A lot about why people don't share stories. In communities of faith, one of our workshop participants summed it up for me. She says, hope deferred makes the heart sick. And what that means is that in speaking with people who desire to change, they don't share because they typically have lost hope in the power of storytelling. We've learned that some people don't share for fear of embarrassment or shame. They're concerned about their personal situation, about having to ask for help. They're worried about what people will think about them, not knowing where to go for help. And some people just overall feel that they're inadequate, some to share their stories. Maybe they're not delivering their story in a way that they believe will translate into action. I've heard from people who were concerned about literacy skills And they were worried about writing stories because of poor writing skills. I think the most striking thing that I've learned in my time is that people don't think their stories matter. They hear about, they hear about other people's lives and they think to themselves, well, my situation is not as bad as what I hear, so maybe it doesn't matter.
Doing this work, I'm sure you're learning so much about like how we move past these barriers to collecting and sharing lived experiences. Can you talk a little bit about that?
One way that we kind of work past barriers with sharing lived experiences is we try to take advantage of current events and to connect them to our issues when possible. So earlier this year, we collaborated with the Tennesseans for Historical Justice, and we held a webinar to encourage people to take action by inserting themselves in the public narrative by sharing their stories. And we had an opportunity to use the Emmett Till movie, which was premiering as a primetime special as the backdrop for that webinar. And we were also able to use Mamie Till's courageous story and the consequently the Emmett Till anti-lynching bill, that Act of 2022. We were also able to use those that law to show the significance and the importance of one story. Right now, we are collaborating with Oprah Winfrey and the Smithsonian Institute to work with HBCUs to show another film, The Color of Care. And it's our hope that each of these viewings will be followed by a panel discussion. And within those discussions, one of the calls to action will be, share your story. Does this resonate with you? And, so I guess overall, the one thing that I would say to other advocates is, in military movies, we hear them talk about chatter, and these alert levels go up when they hear certain chatter. And I feel like, that the chatter should be about those experiences that the clients and the people that we represent are having, that we should become the chatter, that we should be, in this case, that people's lived experiences are the chatter that the public media and our elected officials need to be picking up on. We are the chatter makers and we are the chatter carriers, and the experiences of the people that we stand with is the chatter that we should really be spreading.
Well, I love that. The chatter makers, the chatter carriers. Thank you so much for sharing your advocacy with us today and talking through the amazing work that you and the team at Tennessee Justice Center are doing. I know that this work takes so much, and collecting stories and collecting lived experiences isn't easy, but it's so important. So thank you so much. Thank you for taking time to talk with us for this Working Better Together blog series. And we look forward to NHELP working with you and Tennessee Justice Center for years to come. So thank you.
Thank you for having me.